Hello, everyone. My name is Grace Hernandez, and today I will be discussing the invisibility of chronic pain from the podcast known as Ethics Talk. So, a quick summary of the case. The case circulates around Kim Christensen, a woman who suffered from a spinal cord injury which left her with visible limited physical mobility and chronic neuropathic pain, which can be perceived as invisible disability. She speaks about her experience living with both. She works as a nurse and lactation consultant at Amida Health Resurrection Medical Center in Chicago, Illinois. Dr. Natalie Hoff is a physical therapist specializing in chronic migraine care at the Diamond Headache Inpatient Clinic, and she discusses rehabilitative strategies for chronic pain sufferers. Kim's story revolves around navigating reduced mobility, fatigue, and persistent pain, and how these challenges are often overlooked clinically. She highlights the emotional burden of not being believed or fully comprehended by those around her. Dr. Hoff's perspective outlines a holistic model of physical therapy by emphasizing the need to tailor treatments to each individual's experience, not just the diagnosis. She advocates for comprehensive care, which includes physical techniques, mindfulness, and reinforcing the education needed to empower patients to manage their pain. So, I want to start off and talk about some key themes of this case. Invisibility of chronic pain. Pain that's not visibly apparent often leads to misunderstandings, skepticism, creating barriers in clinical, social, and personal contexts. Ethical responsibility. Healthcare professionals must acknowledge and validate patients' lived pain, even without objective diagnostic proof. Holistic care models. Effective chronic pain management requires patient-centered approaches combining physical therapy, mental health support, and patient education. So, in conclusion, all of these key themes aid into highlighting the ethical imperative to treat chronic pain as a real and debilitating condition, even if it falls under the category of invisible. It encourages self-advocacy and pushing back against stigma or doubts when it's about seeking care. This leads to the gain of empathy and better public understanding around the experiences of people living with chronic pain. So now we're going to talk a little bit about the ethical and legal considerations. So starting with the ethical standpoint, respect for patient autonomy, chronic pain is subjective and often invisible, meaning patients' reports are the primary source of information. Clinicians must trust and respect what patients say about their pain, even when tests do not show clear causes. Providers should avoid dismissing or minimizing patient experiences based on a lack of objective data. Some areas that lead to ethical failures include medical gaslighting, gatekeeping care, and undermining trust. When I say gatekeeping care, I'm referring more to the delaying or denying of referrals. From the legal standpoint, the injustice, inequality in care, patients with chronic pain, especially women, people of color, or low-income individuals, often face systemic disbelief and unequal treatment. The invisibility of chronic pain can amplify biases in healthcare, leading to misdiagnosis, undertreatment, and stigma. Clinicians must actively work to reduce disparities and provide equitable and non-judgmental care. This connects to medical liability, anti-discrimination laws such as Title VI, and implicit bias training mandates. So now we're going to talk about the parameters and considerations for the case, and I will be providing some examples. Parameters include legal limits, laws and regulations, institutional policies, ethical principles, clinical guidelines, patient rights, and provider responsibilities. When it comes to considerations, patient autonomy and credibility, balancing effective pain relief with risks, avoiding harm by dismissal or undertreatment, addressing potential biases, managing diagnostic uncertainty, and reinforcing trustful communication. So I also wanted to explain a little bit what parameters refers to. Parameters in ethics refers to the determining of the ethical codes for how an individual must interact and behave with others in a society. Ethical considerations guide the conduct of research or practice to ensure fairness, transparency, and respect for all parties involved. So, now I will be talking a little bit about stakeholders, but before I get into this topic, I'm sure a lot of people ask, what are stakeholders? So, stakeholders refer to the moral principles and standards that guide behavior and decision making in relation to the stakeholders, who are individuals or groups affected by or with a stake in the performance or a business. So, I will be breaking it down into three different categories, starting with the patient. For the patient, the experiences are of real, often visible suffering. Like Kim, patients who want to be believed and treated with dignity. It is also important to mention how many patients can be misinterpreted to be drug seeking. For the clinicians, they must make decisions with limited objective evidence while balancing empathy with concerns about overprescribing. It is possible for clinicians to unintentionally struggle with time, policy constraints, and systemic pressures. For health institutions, they are responsible for enforcing policies regarding opioid prescribing and treatment access while also being equitable when it comes to care and minimizing harm. They may unintentionally create bias or gatekeeping. So, after all this information has been covered, I also wanted to include some follow up questions. So, my first question is, what structural changes could reduce the stigma of invisible illness? My second follow up question, it would have to lead to what biases may influence a provider's response to a patient reporting chronic pain. So now I'm going to be discussing the conclusion. Chronic pain, though invisible, is a real and debilitating condition that can be experienced. Ethical care means trusting patients and avoiding dismissal or delay. Clinicians must balance medical caution with empathy. Systems and policies can support equal and personalized care, and a shift towards holistic, patient centered models is an essential element to caring for those with chronic conditions and in general terms. Well, with this, I hope you guys learned a little bit more about chronic pain and invisible disabilities. Thank you so much.